clips, you have empathy and therapeutic touch. You can see how I'm actually working with the patient, trying to convey a sense of empathy to them, showing them that although I'm not in the situation that they're in, I do understand or have a sense of understanding of what they're going through and can relate a little bit to them. Not necessarily that I know what they're feeling, but rather that I know that they're going through tough times or troubled times and that I am there for them. And then the therapeutic touch is a technique that can be used for communication in which you may or may not know the right words to say, but sometimes just a gentle hand on the shoulder or knee will express to a patient that you truly do care as well. In the second clip, you can see the use of mutuality, in which we work together to establish health goals for the patient and come to an agreement as to how we're going to obtain those health goals. And then the third and last clip is just basically a clip on what not to do, how not to be empathetic, how to avoid touch, as well as how to not be mutual in attainment of goals. Hey, Mr. Smith, my name's Brad, I'm a nurse today.
Hey there.
I was coming in here, just want to know if you want to talk about your recent diagnosis of being HIV positive.
Yeah, I'm not too happy with what's been going on, my illness that I have, and how my life's going to be affected by this. I just don't know.
No. I understand that's rough news for someone to get. I mean, definitely that must be tough. But you know what? There's nowadays there's things that we can do for you, and we have antiretrovirus medication that you can take, and it doesn't mean that your life has to come to a screeching halt. You can still live a active, normal lifestyle. There's some changes you'll have to make in your behavior, possibly,
Okay.
or but for the most part, you know, you can still lead a fairly normal lifestyle. It's not the end of the road for you. There's still a future for you.
That's good to hear. I guess I should have been more careful with my partners and, you know, then be more safe.
You know what? That's the thing about HIV and AIDS. There's this preconception that you can look at somebody, you know, who has it. There is no way to tell who has it or not.
Yeah.
And don't worry about your past mistakes. What we gotta do is move forward and just make sure we take the right steps now to protect you and any future partner or your current partner for the future, to make sure that your loved ones don't get the same diagnosis passed on to them.
Well, thanks for the talk. I appreciate it.
No problem. Anything else we can do for you today, sir?
That'll be it, I think.
All right.
All right.
If you need anything else, just hit that light on the call button over there, and I'll be right back in here for you.
Thanks.
Hi, Mr. Smith and Brad, nurse, back to talk to you again. Actually, right now, I just want to kind of go over your health goals for right now.
Yeah, well, I'm not really too happy about what's been going on. I just don't want to go on with my life feeling weak and sick all the time. Is this something I'm going to have to deal with forever?
You know what? The antiretrovirus medication we talked about earlier, that will definitely help you stay healthier as an individual. It'll help to hopefully keep those symptoms of the disease down, if not eliminated. The only problem with this is going to be several pills that you will have to take every day on a regular basis for the rest of your life.
I really hate pills. I can't stand taking more than 2 pills at a time. And, I haven't had this kind of treatment. I don't know if I'm going to be able to cope with it for the rest of my life.
Well, the goal you just said, you don't want to feel weak, you don't want to feel sick for the rest of your life. This medication will help you to feel better and hopefully prevent you from feeling sick and weak, and it'll help you lead a more normal lifestyle. So if you can deal with that, you can reach that health goal.
Okay, well, I guess I understand the benefit of that, and I guess it's really important for my goals and for my health. But, I just really hate making the trip to this hospital. It's so far away, and I'm going to have to be doing this. It's going to be a hassle.
You will have to come back to the hospital for testing on occasions to make sure we'll monitor your status. However, if this is a place you don't want to be, we could maybe arrange it so that you go to an outpatient setting where you have a time slot where you go in, be fairly quick in and out, and you won't have to come all the way to the hospital here, but rather hopefully a local, someplace that's local in your community would probably be much more convenient and work around your schedule.
Okay, well, I didn't know about that. Well, thanks for the information. I guess that could work out for me. I'd rather do that.
Great. So it sounds like you are ready and able to take the medication as well as to be seen in an outpatient facility if we set it up for you.
Ready to make that next step.
Thanks, great. Brad. Thank you. Appreciate it.
Oh, hey.
Hey, Mr. Smith. I'm Brad, the nurse today. They make me come in here to ask about your health goals for the day.
Well, I'm just really upset about what's been going on. I don't want to feel sick and weak and for my entire life.
Well, that's what happens when you catch HIV. We have medication we give to you. You have to take it every day. It's a bunch of pills we have to take for the rest of your life.
I don't like pills. I don't want to take them for the rest of my life.
That's too bad. You got HIV. You got to take care of it now. You can take this medication. That's really all you can do.
Do I have to come to the hospital?
Yeah, you're gonna have to come here. We're gonna have to come back here for testing probably every month or so, and you have to come back.
Come in here.
Oh, you know what? You should have been sleeping around doing things you do. Now you're gonna have to deal with it.
I guess. Well, what do you think I should do? And is there anything else I can do?
No, that's about it. All you can do is just take this medication. You have to live with it. You're gonna have to stop doing things you do and just completely change your life.
That's easier said than done.
That's what happens. Sorry, sir. Alright, in the two skits, as I said, we showed empathy and mutuality in the first one, and then in the second one, the use of touch. Empathy and mutuality can be found in Chapter 6, Bridges and Barriers in the Therapeutic Relationship, under this section of Bridges to the Relationship, page 106 and 107. Empathy, you're going to communicate a sense of understanding to the patient, as well as show an ability to be sensitive to the patient. With mutuality, you're going to make sure that with the patient you come up with a common goal as far as their health concerns and whatnot. Just a sense of finding a goal together that agrees with your patient's idea of health. And then for a sense of touch, you find that in Chapter 10, which is developing therapeutic communication skills under sections of other forms of communications, pages 192 and 193. And touch is the first sense to develop and the last one to leave, and it also is a nurturing form of communication and validation that can be used with the patient to communicate with them non-verbally or verbally. And that is it.